Welcome to this comprehensive overview of back and neck pain. These conditions are among the most common and costly health issues worldwide, affecting millions of people across different age groups. Today, we'll explore their causes, how they are diagnosed, and the various treatment options available. Our goal is to provide clear, evidence-based information to help you understand and manage these conditions effectively. The importance of back pain. Back pain isn't just a minor inconvenience. It's a major public health issue. In the U.S. alone, it costs over $200 billion annually in medical expenses and lost productivity. It is the leading cause of disability among individuals under 45 and the second most common reason for doctor visits. In fact, more than 80% of people will experience significant back pain at some point in their lives. Understanding its impact highlights the importance of effective prevention and treatment strategies. Anatomy of the spine. Anterior structures. The spine is a complex structure that provides support and mobility. The anterior part consists of vertebral bodies separated by intervertebral discs, which act as cushions and allow flexibility. Over time, these discs can degenerate, leading to a loss of height and potential pain due to reduced shock absorption. Posterior structures. The posterior spine includes vertebral arches and bony projections. These structures anchor important muscles and ligaments that control movement. The spine's flexibility allows bending, twisting, and extension movements, which are essential for daily activities. Nerve root anatomy and radiculopathy. Radiculopathy occurs when nerve roots are compressed or irritated, leading to pain, numbness, or weakness in the arms or legs. The symptoms vary depending on which nerve root is affected. Proper diagnosis is key to determining the best treatment approach. Types of back pain. Back pain is categorized into four main types: local pain caused by direct injury, referred pain originating from internal organs, pain originating from the spine itself, and radicular pain that follows a specific nerve root pathway. Identifying the type of pain helps in choosing the most effective treatment. Physical examination of the back. A thorough examination includes checking for abnormal spinal curvature, tenderness, muscle spasms, and restricted movement. Tests like the straight leg raise help determine if nerve compression is present. Neurologic examination for back pain. This involves testing muscle strength, reflexes, and sensation to detect any spinal cord or nerve damage. Early detection of neurological issues can prevent long-term complications. Diagnostic studies for back pain. Laboratory tests are rarely needed, but imaging studies like X-rays, Connecticut scans, and MRIs help assess spinal conditions, especially after trauma or when symptoms persist. Cautions with spine imaging. Spinal imaging often reveals age-related changes that may not be the cause of pain. Unnecessary imaging can lead to overdiagnosis and inappropriate treatments, so clinical evaluation is crucial. Electrodiagnostic studies. Electrodiagnostic tests evaluate nerve function and help pinpoint the exact location of nerve damage, aiding in diagnosis when physical examinations are inconclusive. Lumbar disc disease, a common cause of lower back pain and leg pain. Lumbar disc disease is often due to herniated discs that press on nerves. This can lead to discomfort, numbness, or weakness in the lower body. Cauda equina syndrome, a serious condition caused by compression of multiple lower back nerve roots, leading to severe pain, muscle weakness, and loss of bladder or bowel control. This is a medical emergency that requires immediate surgery. Lumbar spinal stenosis. This condition involves narrowing of the spinal canal, which puts pressure on the nerves and can cause pain, numbness, and weakness, particularly when standing or walking. Treatment of lumbar spinal stenosis. Mild cases can be managed with pain relievers, physical therapy, and activity modifications. In more severe cases, surgery may be needed to relieve nerve pressure. Spondylosis and spondylosis. Spondylosis refers to degenerative arthritis of the spine, while spondylosis occurs when one vertebra slips forward over another. These conditions can lead to chronic pain and instability. Neoplasms causing back pain. Cancerous growths in the spine, such as metastases from other parts of the body, can cause persistent, deep pain that worsens at night. Imaging studies help in early detection and treatment planning. 8. Spinal infections. Infections like vertebral osteomyelitis and epidural abscesses can lead to severe back pain, fever, and neurological symptoms. Prompt diagnosis and treatment with antibiotics or surgery are essential. Traumatic causes of back pain. Spinal fractures and dislocations from accidents or falls can cause severe pain and even paralysis. Imaging studies, particularly CT scans, are crucial for diagnosis. Metabolic causes of back pain. Conditions such as osteoporosis can weaken bones, increasing the risk of fractures and chronic pain. Preventative measures include calcium supplementation and lifestyle modifications. Autoimmune inflammatory arthritis. Diseases like rheumatoid arthritis and ankylosing spondylitis can cause chronic back pain and stiffness. Early diagnosis and treatment can help manage symptoms effectively. Congenital anomalies of the lumbar spine. Some people are born with spinal abnormalities like scoliosis or spina bifida, which may lead to pain and mobility issues later in life. Referred pain from visceral disease. Pain from internal organs, such as kidney disease or aortic aneurysm, can sometimes be mistaken for back pain. Identifying the true cause is vital for appropriate treatment. Other causes of back pain. Chronic pain syndromes, psychological factors, and even stress can contribute to persistent back pain, highlighting the importance of a holistic treatment approach. Global considerations in back pain. Back pain is the #1 cause of disability worldwide, affecting people across all demographics. Understanding cultural and regional differences can aid in global treatment strategies. Treatment of acute low back pain. Most cases resolve on their own with conservative care, avoiding prolonged bed rest and encouraging gentle movement to aid recovery. Medications for acute low back pain. NSAIDs and acetaminophen are the first-line treatments, while muscle relaxants and opioids should be used sparingly to avoid dependency. Treatment of chronic low back pain. Managing chronic low back pain requires a combination of physical therapy, lifestyle modifications, and sometimes medications. Exercise therapy, particularly core strengthening and stretching, plays a crucial role. Cognitive behavioral therapy can help patients manage pain perception and improve coping strategies. Medications like NSAIDs, acetaminophen, and duloxetine are commonly used. Addressing underlying depression or anxiety can also improve outcomes. Multidisciplinary rehabilitation programs provide comprehensive care for long-term pain relief. Complementary treatments for back pain. Alternative therapies can supplement conventional treatments. Spinal manipulation, often performed by chiropractors, may offer short-term relief. Massage therapy can help relax tense muscles and improve circulation. Acupuncture is an option with some evidence suggesting benefits. However, treatments like TENS, transcutaneous electrical nerve stimulation, laser therapy, and ultrasound lack strong scientific support for long-term effectiveness. Injections and interventions for back pain. For some patients, injections may provide pain relief. Epidural steroid injections can help with acute radicular pain, but are not a long-term solution. Facet joint injections are used both diagnostically and therapeutically. Radiofrequency denervation is sometimes performed to reduce chronic facet joint pain. Intradiscal therapies, including ozone and regenerative treatments, are still experimental and lack conclusive evidence of efficacy. Surgery for chronic low back pain. Surgery should be reserved for severe, refractory cases. Evidence supporting spinal fusion for chronic low back pain remains weak, and outcomes do not always surpass those of non-surgical treatments. Lumbar disc replacement is another option, but remains controversial due to inconsistent long-term results. Surgery should only be considered when conservative measures fail, and imaging confirms structural pathology correlating with symptoms. Treatment of radiculopathy. Most cases of radiculopathy improve over time with conservative management, including NSAIDs, acetaminophen, and activity modifications. A short course of opioids may be considered for severe pain, but prolonged use should be avoided. Epidural steroid injections can provide temporary relief. Surgery is indicated if neurological deficits worsen or pain persists despite conservative treatment. Surgical treatment of radiculopathy. When surgery is necessary, options include discectomy, laminectomy, or fusion. Discectomy is typically performed for herniated disc compressing nerve roots. Laminectomy is used for spinal stenosis cases. Fusion is reserved for patients with significant spinal instability. Surgical outcomes are generally favorable when properly indicated, but long-term results can vary. Neck pain. Overview. Neck pain is a common issue resulting from cervical spine disorders, muscle strain, or nerve compression. It can be acute or chronic, and symptoms range from mild discomfort to severe functional limitations. Identifying the root cause is key to proper management. Trauma to the cervical spine. Trauma from motor vehicle accidents, falls, or sports injuries can lead to cervical fractures or spinal cord injuries. Immediate immobilization is critical to prevent further damage. CT scans are preferred for fracture detection, while MRIs assess soft tissue and spinal cord involvement. Whiplash injury. Whiplash is caused by rapid flexion-extension movements, commonly seen in car accidents. It often results in neck pain, stiffness, and headaches. Most cases resolve with conservative treatment, including pain relievers and physical therapy. Persistent cases may require further evaluation. Cervical disc disease. Degenerative changes in cervical discs can cause pain, stiffness, and radiating symptoms in the arms. MRI is the best diagnostic tool. Treatment options include NSAIDs, physical therapy, and, in severe cases, surgical intervention. Cervical spondylosis. This age-related condition involves degenerative changes in the cervical spine, often leading to neck pain and stiffness. Osteophytes, bone spurs, may compress nerves, causing radiculopathy or myelopathy. Management includes pain relief, physical therapy, and sometimes surgery. Other causes of neck pain. Various conditions, including rheumatoid arthritis, ankylosing spondylitis, herpes zoster, and referred pain from heart disease, can mimic spine-related neck pain. A thorough assessment is essential for accurate diagnosis. Thoracic outlet syndromes. These syndromes result from nerve or vascular compression near the shoulder. Symptoms include arm pain, numbness, and weakness. Treatment typically involves physical therapy, but severe cases may require surgery. Brachial plexus and peripheral nerve disorders. Injuries or compressions of the brachial plexus can mimic cervical radiculopathy. Conditions such as radiation damage or neoplastic infiltration should be considered in persistent cases. Shoulder disorders, mimicking spine pain. Shoulder conditions like rotator cuff tears and bursitis can cause symptoms similar to cervical radiculopathy. Distinguishing between shoulder and spine pathology requires a careful clinical examination. Global considerations in neck pain. Neck pain is the second most common cause of years lived with disability globally. Regional variations exist in prevalence and treatment approaches, often influenced by cultural and socioeconomic factors. Treatment of acute neck pain. Management is similar to that of acute low back pain. NSAIDs, acetaminophen, and gentle stretching are recommended. Prolonged immobilization should be avoided. Treatment of chronic neck pain. Exercise therapy, acupuncture, and cognitive behavioral therapy are key components. Surgery is considered only for persistent disabling cases with structural abnormalities. Treatment of cervical radiculopathy. Most cases resolve with conservative management. Oral steroids, NSAIDs, and physical therapy can help. Epidural steroid injections may be beneficial, though they carry risks. Surgical treatment of cervical spine disorders. Surgery is indicated for progressive neurological deficits or persistent pain. Options include anterior discectomy, laminectomy, and fusion. Artificial disc replacement remains a developing option. Multiple choice questions. MCQs. These slides contain a series of MCQs to reinforce key concepts covered in the presentation. Questions test knowledge on spinal anatomy, diagnostic techniques, and treatment strategies. Thank you for engaging with this presentation on back and neck pain. We hope this knowledge empowers you to make informed decisions about spinal health. Always consult a healthcare provider for a thorough evaluation and personalized treatment plan.